a kid that has an obvious deformity at 14, 15, and sleep apnea is a problem, they're not really tolerating a CPAP or don't want to wear a CPAP, they're suffering. They're suffering not only from the social aspects of having whatever position that they're in that's unfavorable, but also from the health aspects that they're not breathing well, they're not sleeping well, they're not speaking well. And it's such an important time for these people. They're developing. Where is it more important to sleep and get oxygen than in development? Some of these things are irreversible in terms of time period.
Totally.
So if you can get a kid out of trouble and make them healthier faster in a predictable, stable operation, it's a no-brainer. But we have that now where traditionally we didn't have that. The problem is people still operate off the traditional textbooks and philosophies, not really realizing that that was a different time.
Right. I'm trying to think of an analogy. Maybe it's like we talked a lot this week about the analogy between surgical technologies and like military technologies. Maybe it's like people are still reading the military textbooks about like pre-aircraft, right? And they're like, oh, we have to send this many people on the ground, otherwise the invasion won't work. Yeah. When in reality, the technology exists where maybe you only need to put 50,000 on the ground and the rest can be by air, instead of sending 1 million by ground, storming the beach or something, right?
Right.
So people are still using old philosophies, even though new tools are available. They're still reading old textbooks where it says you can't treat anyone over 50 with jaw surgery. Right. You can't treat a 15-year-old.
Correct.
Even though the technologies totally allow for it.
Completely different now.
Right. So specifically with older patients.
Yeah, same philosophy. I mean, it was in the past, it's like, are you going to put an older person? Older people have more comorbidities, especially if they have these deformities for a long period of time, right? They've been having sleep apnea for a long time, which affects their heart health, their lung health. So their ability to safely go under things, it's not like a teenager, right? So there was a hard stop, the risk benefit thing. Again, are you going to put someone and risk this when it's such a difficult thing? But now that it's more predictable, more safe, it's not that there's no risk, there's still risk, but the risk benefit ratio, everything is a bet in life. Right. But it's a better bet.
Right.
And if you have someone that's really suffering and, if you don't do it for these people, it's definite spiral down.
Yeah.
For a lot of these patients, like they're not tolerating CPAP well, or even on CPAP, they're not getting benefit and they're really suffering. And yes, there's risks of doing surgery for these, and it's a discussion we have to have, but there's a definite risk of not doing surgery.
Yeah.
Right. So it becomes, the technology allows us to do it safely, predictably, and makes the risk benefit seesaw way in favor of benefit for patients, where in the past that pendulum was the other way.
Yeah, right. Specifically with older patients, the concern is obviously the recovery.
Right.
Like you wouldn't want to put, I don't know, a 70-year-old through a traditional jaw surgery recovery, but maybe you could put them through a custom jaw surgery recovery.
Yeah.
Have you ever treated someone like 70 plus?
Yeah, 60s, late 60s.
Yeah, would you?
Many in the 60s. Depends on the health of the person. People age very differently.
For sure.
And there are 70-year-olds that are healthier than a lot of 50-year-old patients I see, and vice versa.
No doubt.
Yeah.
And on that note, what was that thing you were telling me about? Part of the reason that younger patients aren't treated is because of a misunderstanding about how bone grows around plates. You were saying that bone is not like wood. People imagine it like putting metal on wood. Wood is like a dead substance, and that what was that you were telling me? Do you remember?
Yeah, I do. So the question is, so we talked about what is the youngest I've ever done jaw surgery.
Yes.
It was around 7 or 8 years old.
Incredible, right.
And this was someone that had a Naegger syndrome, which is a craniofacial syndrome, and really severe small jaw that had already had some distraction in neonate. When he was very, very young, and his jaw had fused, and now he's really far back. And at 7 or 8, his sleep apnea was so bad that the only real option was to do a tracheostomy. which I think for a kid is obviously it's a big deal.
Yeah.
Right. A very big deal. So the risk benefit in this case, knowing that we can do the surgery, I decided to do jaw surgery for her to bring that jaw forward. And the kid did tremendous.
Yeah.
He did tremendous, and it was, safe and successful, and he avoided a trach as he started to grow faster and really thrive, and it was an amazing thing for him.
So the surgery supported a healthier kind of growth.
Yes, exactly, because he's breathing better and sleeping better. He's getting oxygen. So
because why assume that growth in a growing patient after surgery is going to be a negative thing?
Right. Yeah. I mean, if you're breathing better, sleeping better, and you're still growing, it could be a tremendous biohack.
That's just an assumption, right?
Right.
That people make.
Yeah.
That it's going to be negative. It could be positive.
Yeah, definitely could be positive. Definitely should be positive.
Right.
Yeah. So I think, it all comes, all medicine, all surgery, and all decisions, investing, decision of who to marry, what relationship to be in, who to partner business with, everything has risks and rewards to it, and things need to be evaluated for, is it a better bet to do it versus not do it? And, thankfully things in surgery are evolving, whereas there's becoming a greater percentage of people that can benefit from these things.
The pendulum is swinging.
The pendulum is swinging. Yeah.